I'd like to go over a deep paraspinal muscle called the transversal spinalis. And this is a really important muscle for spinal stability. These are very small muscles, and if we look at the Earl of Bergamot here, we'll see that we have the spinous processes and the transverse processes. And in this little gutter along where the spine is here, this is actually where the muscle sits. And it's kind of an interesting muscle, and also that it's the antagonist really deep here of the hip flexors, the psoas and iliacus. Now, if we're going to get in there, we want to make sure that we actually don't do a procedure that pushes on the transverse processes, because this will be extremely painful. But this is an important muscle, not so much in terms of a primary mover, but it has a lot of neurological input. So in terms of proprioception, balance, and motor control, this is a really important area. So first let's go over the lumbar transversal spinalis. Now, it's really important that we do this in the sideline position, because when you're sitting, you're actually going to stimulate the erector spinae muscles, which are going to push out and will actually stop us from going in the deeper muscles, which is the transversal spinalis. So get the patient to lie in the side position. Just bring your arm up there, Mickey. Good. And what you're going to do is you're going to get the patient to actually take their leg across and drop it down. And this is going to be the procedure here. Over and back again. Fairly comfortable there?
Yep.
Good, good. And what you're going to do with your hands on the spine here, it's actually going to be a double thumb procedure. You're going to back up one, and we're going to go right to the spinous processes and then over just a little bit. Now you want to make sure that you don't go over too far on the transverse processes, because if you push in really hard, it's going to be really, really painful. Sometimes when they work with some instruments and people push really, really hard here, there's actually been some cases where they've done damage to the transverse process as it comes off there. So you have to be a little bit careful there. It's quite a sensitive area. Okay, Mickey, I'm just going to go over to the spinous processes here. Take my contact and take your leg across and down. Good. Gets a little more intense as you go down there?
Yep,
Yeah.
right at the end range there.
Okay, and then you're going to hold it, because it's not just working on the muscle, but it's also working on the fascia. Now take it back. So we're going to go across about L5, take it down, and right down. Excellent. You okay?
Yeah,
How's that feeling?
that's actually really good.
Yeah, and back again. So we're going to move our way up, and we're going to go right up the lumbar spine as far as we can. Are you okay there?
Yeah.
So that's not real uncomfortable or anything,
Not at all.
but you feel like it's quite deep.
Yeah, it feels like
Yeah.
it's straightening out my scoliosis.
Okay. This is a good thing. Take it across and down. Good. Excellent. Back again. And we'll go across and down. So obviously we'd work on both sides of the spine. But this is a really powerful motion. You'll find a lot of people that are suffering from low back pain, and they're not really coming around the way they should. This is one of the procedures you can do to loosen up the muscle, so that when you go to adjust or mobilize the lumbar spine, it actually moves a lot easier. You okay there?
Yeah.
Good. And take it back. Good. So let's go over the transversal spinalis for the thoracic region. So Mickey, what we're going to do in this section is we're going to have you take your arm, it's kind of like working on the pec deck here, and going across, but not too fast, and you're going to hold that position.
Okay.
Now, what I'm going to do is I'm actually going to work my way up. I've already done the lumbar section, so I'll actually get in around T12 and start working my way up there. And then I'm going to take both hands, and again, we're going to go right where the spinous process is, just over a little bit in the gutter there, between the spinous process and transverse process, and start pushing over a little bit as Mickey brings her arm across. Okay, just one sec here. Let's get in position here. You okay there?
Mm-hmm.
Okay, take it across, right over. So you're feeling that one quite a bit.
Yes.
So you're not moving, now just hold position. This is really important to just let it go. Okay, now come back again. You okay?
Yes.
Now, let's combine a little bit of respiration with that. I want you to breathe out as you come across.
Okay.
Just so that it releases a bit easier. Okay, breathe out. You okay?
Yeah.
Cross. Good. And back. Now hold it there. And back. Good. Again, I'll go across the spinous process. And this is not always the easiest area to work on to get to release. And just hold that. And you have to hold a little bit, because this is a myofascial release. It's not just the muscle, but the connective tissue, the fascia. And it takes a little bit for this to unwind. Are you okay there?
Yeah.
Good. Okay. This is a great way of opening up the thoracic spine. And as I said, this is actually a good way to open up before you adjust. Just lie your back here for a second. And in terms of manipulation, it's never just working on the soft tissue. We always work on the joints too. People will say, okay, I have a problem in this area and it's just this muscle. In reality, the muscles connect into the joint. The joint is full of neurological receptors that go back into the muscle, so you have to address both. Just grab the shoulders here for 1 sec. Now, I think I'm going to get you to put your chin towards your chest there. I'm just going to palpate here, and you are a little restricted here. You okay to adjust that area there? Down and over. Perfect. Excellent. Okay, come on up here. Okay, now just move around a little bit there in the thoracic area. How's that feeling?
Yeah. Way better. The right
Yeah.
side feels.
A little restricted on the right side still. Yeah, we didn't really do that many passes,
Yeah.
and already you can feel it open up.
Yeah.
Really is a powerful procedure. One thing I want to go over is the subtlety of the motion when we're addressing specific areas for the semispinalis, the multifidus, and the rotatories. Now, the width of my thumb is basically the width of the groove where all of these muscles sit between the spinous process and the transverse process. So this little area right in here, that's about how wide it is. Now, when we actually get to the end range of the motion and we stop, if we want to address the semispinalis, we're just going to go slightly vertical. If we're going to go on the multifidus, we're going to rotate over and move up at an angle, kind of like this to about 66 degrees, and that'll be multifidus. If we're going to go on the rotatories, we'd actually go horizontal, and we'd actually just take and change it a little bit. This is such a subtle motion, and yet your patient is going to feel it, and you'll also feel the striations between these different structures breaking up. This is really a powerful technique.